The hospital medicine movement is 20 years old, and since that time we've seen its numbers expand 100-fold. Hospital medicine has shown real benefits to patients in terms of decreasing their length of stay, improving their functional outcomes after hospitalization, and making sure that they get appropriate care from the beginning of their hospitalization all the way to the end. The Virtual Hospitalist Service is a new service with the University of Iowa. What we're doing is taking some of the expertise in delivering high-quality inpatient medicine and bringing it out to the community, where they have very good local providers who have been doing this for a long time and know their patients very well, but who don't know some of the newest innovations in delivering hospital medicine to get better patient outcomes.
The use of DVT prophylaxis, what's appropriate, what's not, talking about CHAD scores and the use of Coumadin and atrial fibrillation. I could go on and on and on. These are things that we know, but there's things that change. And this allows us to keep up to date on the things that are changing in medicine, that we can't always leave and go for a conference 5, 6, 7, 8 times a year, which is what it would take to keep up on the things that we are being brought up to date with the hospitalists.
We are able to have twice a day, at minimum, our providers talking to the providers at the University of Iowa, planning care, looking at results, making decisions about the care. It really engages us in learning on a totally different level. We're really thinking outside the box, discussing cases. It's like grand rounds twice a day.
Good morning, Dr. Blair.
Good morning.
Yeah, are we ready to round this morning?
The Virtual Hospitalist program uses secure video conferencing so that I can talk with patients and providers in Van Buren County Hospital the same way that I would if they were face-to-face with me here in Iowa City. That video conferencing allows us to establish the patient-provider relationship even though the patient is located more than 90 minutes away from where I am. Every day in the morning, the virtual hospitalist here at the University of Iowa talks with the providers and the patients in Van Buren County Hospital. We review their electronic health record and any developments that those patients have had over the last 24 hours. That integration of the electronic health record allows me to provide the same high-quality inpatient care in collaboration with the excellent providers in Van Buren County Hospital.
His vitals otherwise look good. I thought he'd be okay to go home. It looks like he's on ceftriaxone and levofloxacin. It is always good to talk to another provider. 2 heads are definitely better than 1.
Well, the doctor just came in and his assistant, and they had the iPad, and pretty soon I was talking to a lady in Iowa City.
This will be the wave of the future. We can't bring all of the specialties always to us and all of that resources to us, and that's why technology is now so wonderful. We can have that from far away without our patients having to go up every single time that they need that specialty care or that input. Some of the other impacts it has is the ability to have a patient stay locally when maybe they would have been transferred much sooner. We still obviously need to transfer appropriate patients to the University of Iowa, but there's a lot of patients that are in that gray zone that normally we maybe would have transferred in lieu of having their care maintained here while we collaborate with the university. It just really engages you in a different level of taking care of the patients, and the patients sense that because they'll say, those things specifically to us, and families have said that, how they feel just really excited, very well taken care of, that things have been very comprehensive, and their amount of information that they're getting back on their care and what to anticipate has really increased, so that's really exciting.
My name is Lisa Bensinger, and I work here at the hospital, and my mother was a patient here last week. She didn't at first kind of know what was going on, but then she realized this is, there's the doctor from Iowa City that she could talk to and face-to-face, and she could ask any questions. She was very comfortable with that. Just knowing that we can stay here is just a relief for everybody, especially my parents who are definitely getting older, and it's a wonderful, wonderful thing to be able to stay in your local hospital. They took such good care of her, and the doctor, through this e-hospitalist was just wonderful. And, having a face-to-face without actually having to go to Iowa City was wonderful. So we loved it.
It was not only a success because the patient got to stay local longer. They were also transferred to the U in a seamless process where we had planned it out ahead of time. The family members were able to make that, the arrangements and the plans for that, and she was met on the other end by somebody who was already familiar with her care. So that was a big success story, and that patient and the family were very, very pleased with how everything went.
As a provider thinking about these improvement in transfer using the virtual hospitalist, it makes my life a lot easier. Because when I'm already talking to someone that they already know who I am, we've already talked about the patient, to know that they are assisting with that transfer so that they can take care of my patient, makes me feel much better about the whole process. This is my 4th round in telemedicine in my lifetime, and this is the one that has worked by far the most and the best and the most seamless. Probably a big part to why this is working well, because the hospitalists that are involved at the university are very excited about it, and they want to see it work, just like we want to see it work.
The goal of the University of Iowa Academic Hospitalist Program is to provide high-quality inpatient care to all patients within the state of Iowa. Until this point, we've been limited to delivering care to patients here in Iowa City, but the majority of patients don't live in Iowa City. And if we can provide high-quality inpatient care to them in their communities, it's going to result in a better patient experience, where they don't have to leave home, where they can be surrounded by their families and in the communities where they live.